In this video, we'll discuss about anticoagulant drugs. There are two types of anticoagulant. First one is parenteral anticoagulant and another one is oral anticoagulant. This parenteral anticoagulant, the prototype drugs is heparin. So prototype drugs is heparin. In this oral anticoagulant, the drug is here warfarin. Warfarin. Oral means warfarin tablet are available. Parenteral means heparin do not come in tablet form. It is come in injectable form. So it is come in subcutaneous form or injections are there. So we have heparin injections. We have heparin injections are there. So we have two type of anticoagulant, parenteral and oral anticoagulant. These are the drugs. Mainly we want to discuss this heparin and warfarin. For anticoagulant, we want to understand coagulant. Then only anticoagulant simple. So first understand coagulation, then we will understand what is anticoagulation. Suppose this person have cut. What is happen? Bleeding. What happen next? How long it will bleed? Next few seconds or few minutes. After that bleeding stop automatically. Have you ever thought how does the bleeding stop automatically? How does? Because of that mechanism. That mechanism name is called as homeostasis. What is homeostasis? Homeo means bleeding, status means stop. So it is a stoppage of the bleeding automatically. That's why we have 5 liter of blood. That is the fluid. We all have the adult body. Whenever we have cut, that time hemostasis, bleed will leak from injured blood vessels, and we will go in shock and we will die. But it does not happen because we have inbuilt mechanism that is known as homeostatis. If there is a blood vessels in this endothelial lining, here endothelial lining, the blood vessels interrupt. So in this area, affected area, this area, affected area, so blood vessels is interrupted. That means this is the site of injury. Here bleeding takes place. Okay, so automatically here clot will form here. So clot platelet will come, then clot formation. The clot first, the platelet will come. It will seal the area. It will seal that area so that the bleeding will stop. But this is the temporary clot. It is known as primary clot. It will rupture. We have to stabilize it. So stabilization required thread for stabilization. So first platelet will seal that area. So that just suppose we have a cut in our fingers, the blood vessels is injured, bleed, so we want to seal. So platelet will seal that area, but it is temporary. It is known as primary clot. Primary clot. If we want to convert the primary clot into secondary clot, that is stable. Okay, that one is the stable. So we need a thread name is called that fibrin. What is fibrin? In our blood 12 coagulation factor is presented. totally 12 coagulation factor is presented. So factor number 1 to factor number 12 coagulation factor are present. Factor number 1, this factor number 1 is fibrin, but they are all inactive. So how does it get active? So there is a cascade. This one is the cascade. It is not directly we can active one. Okay, we want to active this one, the one will come here thread. Okay, it only will come here thread and tie it, particularly cascade, intrinsic pathway and extrinsic pathway. Common pathway, this one is the intrinsic pathway 12 11 9 8. Extrinsic pathway 7. This one is the common. Okay, intrinsic means 12 11 9 8 10 5 2 1. Extrinsic means 7 10 5 2 1. So both, this one is the common pathway. So we understand this cascade, we can understand that anticoagulant. We want to activate this factor number 1. This one to make a thread image. So it will give a thread image. The thread over the platelet clot, and the platelet clot is already there. We want to dye it. Okay, we want to tie it with a thread. We want to stabilize the primary clot to secondary clot. Primary clot and converted into secondary clot. So we want a thread, but it cannot activate directly. We need a cascade get activate. Finally, once it is getting activate, it will stabilize the clot. So how does fibrin get activated? So there are the two pathway, extrinsic pathway and intrinsic pathway. Yeah, this intrinsic pathway, as soon as we have injury, factor 12 get activated. 12 leads to activation of 11. 11 leads to activation of 9. In 9, the presence of 8 leads to activation of 10. 10 in the presence of 2 leads to activation of 1. Finally, this is intrinsic pathway. This one is the common pathway. Here, this extrinsic pathway. Here we have 7. Extrinsic pathway we have only 7, directly activate 10. So this one is the intrinsic pathway. This one is the extrinsic pathway. So these are the things is the common pathway. Finally we have one. This is the thread rope fibrin. So we want to activate fibrinogen into fibrin, that will converted our primary clot to secondary clot. This primary clot is converted into secondary clot. All the things happen inside our body. Ultimately healing takes place. How the clot takes place? God is this clotting. So here we learn 2 times the time required for activation of intrinsic and common pathway. This is known as APTT. The time is required for extrinsic plus common pathway. This is known as PT. PT include 7, 10, 5, 2, 1. APTT include this intrinsic and a common pathway. So time required intrinsic plus common is known as APTT. The time required this extrinsic plus common, this is known as PT. Anticoagulant 2 drugs, warfarin and heparin. Warfarin is interrupting at what level and heparin is interrupting what level, we want to discuss. Out of that, we have totally 12 factors. Out of these, all 4 factors belong to intrinsic This factor will okay, this the one is intrinsic, this one is the extrinsic. This one is the common pathway. This one is fibrin is a thread that will stabilize our clot, that will converted our primary clot to secondary clot. Clot is stabilized, so bleeding is stopped. If we want to stop bleeding, this is happen in the blood. Temporary clot is stopped by platelet, but it is not permanent. Gradually inside our blood, this all is happening, and ultimately factor 1 is coming and dying, tying and drying the thread over the platelet. So bleeding is permanently stopped unless or until the healing takes place. So this is known as clot takes place. This is called clotting. Now we want to discuss anticoagulant. First one is warfarin, second one is heparin. Warfarin is interrupting at what level? Then heparin is interrupting at what level? Four of them required vitamin K for their activation. Factor number 2, factor number 7, factor number 9 and 10 required vitamin K for their activation. So all, so these four all mm, go in the liver. These four things will go to that liver, get activated by vitamin K and come back. These four are inactive. So out of 12 factor, 2, 7, 9 and 10, these four required vitamin K for their activation, and activation takes place in the liver. In the liver, vitamin K activate them, then they come in the blood. They are synthesized in the liver, first get activated by vitamin K, then come in the blood. So now discussing the drugs. Anticoagulant overview. The drugs anticoagulant we give the patient having thrombosis. Okay, in thrombosis there is over clotting. We don't want the clot to make in the thrombus. What is thrombus? So this is the blood vessels. Here also blood vessels. Here endothelial lining having ruptured, so bleeding takes place. So we want to clot them. Platelet should come over, the fibrin should come. We want to clot. Okay, so here clot formation, this one good for us. This one is the hemostatism, but here without injury. So here no distraction. Okay, so continuous only endothelial cell is presented. So here what will happen? Without injury, uh, clot formation, sometimes clot form without injury. This is not hemostasis. The mechanism hemostasis is useful for us. It stop, okay, this one is stop bleeding. It does, if does not occur, we will bleed. This one not occur means bleed, we will die. This is the useful. It is not a diseased condition. It is physiology, but without injury. If the same clot is formed, the same platelet plus fibrin, here platelet plus fibrin mechanism is exactly. So not hemostasis, this one is the thrombus. It is a disease because it interrupting the blood flow to organ. So it will affected organ. Here organ is presented, it will disturbing. So here we don't need that clot. So we want to take treatment. We take the drugs anticoagulant. That anticoagulant drugs that inhibit the synthesis of that thread. A platelet clot will be there, but a thread will not come here. So thread will not here. Okay, only platelet only presented. Thread not is coming. So it will interrupt the synthesis of fibrin. Multiple places it will interrupt. So here we are using two type of drugs. We want to block that secondary clot formation. Okay, so that reason only we are using warfarin and a heparin. So let's start with this warfarin, oral anticoagulant. Heparin, that one is the parental anticoagulant. Out of 12 factor, this factor number 2, 7, 9 and 10 record vitamin K further activation. So this is the liver, all are synthesized. But the four things, that is 2, 7, 9, 10, they will become active with the help of vitamin K. But there is a enzyme, okay, with the help of enzyme. That enzyme name is called uh, vitamin K epoxide reductase enzyme. So with this enzyme only they get activated by vitamin K. Warfarin inhibit this enzyme. When we are taking this warfarin, it inhibit this enzyme. So imagine doctor give a treatment of warfarin to that patient, thrombus patient. Tablet will go, it will get absorbed, it will go to the blood. From blood, it will go to liver. Warfarin will go to the inside that liver. There, that 2, 7, 9, 10 they cannot get activated because warfarin will inhibit the enzyme vitamin K epoxide reductase. This enzyme is inhibited. These four factor will not get activated. So we having all the 12, but among 12 these four are non-functional. So extrinsic and intrinsic pathway both are affected. Okay, are both factors are affected because the 7 is presented in extrinsic, remaining presented in intrinsic pathway. So this is takes place inside the liver. Inside the liver there are four activation do not takes place because activation of 4 record vitamin K and vitamin K activation record this enzyme. Warfarin inhibit that enzyme, that vitamin K epoxide reductase. This enzyme inhibited by warfarin, that enzyme is required for vitamin K activation, and that vitamin K is required for 2, 7, 9, 10 activation. So no activation, this enzyme is inhibited. Vitamin K is not activated, 2, 7, 9 and 10 not activated. So clot is not formed, clot will not form, fibrin will not form, clot will not form, thrombus will resolve. Now test for warfarin in vivo and in vitro. What is in vivo? Means in vivo means living person, in vitro means test tube. Let's, there is a clot here also, clot here also. There is a clot in a patient and there is a clot in the test tube. If we put warfarin here, we put warfarin here, so that warfarin, where does it will show its action? If the person, it will resolve that thrombus, it will dissolve that clot because the person having liver, okay, liver is present, it will go to liver, it will block that activation of 2, 7, 9 and 10. Okay, here this here no liver. Okay, so here the in this one 2, 7, 9 and 10 the clot will dissolve, but in the test tube we don't have liver, we don't have liver in the test tube. So here that function only in vivo, not in vitro. Okay, so here function in vivo, here function in vitro. We can demonstrate that function in vivo, not in vitro. Function, because here only liver is presented, so we can demonstrate in vivo only, not in vitro. On the contrary, heparin will have both function in vivo also, in vitro also. What's the use? Here, these drugs. Suppose I am having thrombus, I am taking drugs, it will absorb. Warfarin is a tablet, it will go, it will take with the water, so it will go inside esophagus, stomach, intestine, it will get absorbed. It will go in my blood, from blood it will go to liver, in my liver it will block the activation of 2 7 9 and 10, but my blood already active form is present. 2 7 9 and 10 in the blood already, so that will show the action. So action is not immediate. There is always a delay between administration of the drugs and that effect, so it is used for maintenance, not in emergency, not for initiation. Initiation we use heparin because it takes action. Whatever it is showing that action in the liver, in the liver, in the blood. So we already have some active form, number 2 7 9 and 10 will form. Okay, now 2 7 9 and 10 will not form because warfarin will inhibit that enzyme, but 2 7 9 and 10 already presented in blood. A little bit new will not come, but this will show the action. So warfarin action is never immediate, it is used of maintenance, not for initiation. It will inhibit 2 7 9 and 10. So next, which will go in the blood first? First 7 will go in the blood. So earliest is 7 because half life wise 7 is the earliest. 7 is the earliest. So it so get extinct. So all will extinct from the blood. All present 2 7 9 10 all will extended one by one, but earliest is 7. So pt is affected first, followed by aptt. Aptt will be prolonged, but later on, but first pt is affected because of self lifetime, half lifetime, this one less, so this only first affected. So factor number 7 is the earliest, which will lower in blood. That's why PT will be affected first. So monitoring is done by PT. The ratio of PT, the ratio of PT in a patient upon PT in control. PT in patient upon PT in control is known as INR. So rather than saying PT, better to say INR. So monitoring is done by INR. What is INR? The INR is the ratio of the PT of that patient upon PT of that control, that is INR. So rather than saying PT, the better to say INR. 7 2 7 9 and 10, they all are inhibited. 7 is on intrinsic pathway, but 2 10 9 on intrinsic pathway. So ideally PT, APTT both should rise. Why you are testing only PT, not AP? TT because earliest rise this PT will be affected first because of half life short test half-life is for factor 7 for warfarin. Antidote is present vitamin K because side effect emergency you can give antidote vitamin K. Vitamin K is the antidote because it is blocking that activation of vitamin K. You already give that activated form of vitamin K, so it is the antidote. Adverse effect, sometimes too much bleeding happen. Then alopecia, hair loss. Okay, alopecia means hair loss. The patient baldness is there. Then dermatitis. Then contraindication, never give warfarin in pregnancy period. Parenteral anticoagulant, here we want to discuss heparin drugs list. First page only we have now. Mechanism of action: heparin activate antithrombin 3 which is presented in the blood. So in the blood we have two things. One is this one, coagulate coagulatory factor and anticoagulatory factor. Coagulatory factor we have factor 1 to 12. In this one we have this antithrombin 3, we have 3 anticoagulating factor number 3. So in our blood both are equal and opposite. In normal human being both are equal and opposite. There is a balancing, but if we have any injury due to any cause, if I have any cut here, this coagulatory factor will this one will increase, this one will decrease. So a imbalance will occur, so coagulation will occur and anticoagulation will not occur. But in normal blood vessels there is equal. During injury, coagulation and coagulating factor increasing and anticoagulating will fall. During thrombosis, what is thrombus? Uninjured blood vessels during thrombosis. Without injury, this anticoagulant will increase. So during thrombus period, this one will increasing, coagulating factor will decreasing. So this one we want to understand. Antithrombin factor 3. This is active. This heparin activate. This heparin will activate antithrombin 3. What does antithrombin 3 will do? It will activate the coagulation factor. Out of 12, it will activate. Out of 12, it inactivate factor number 10 and 2. Most importantly, factor number 10 and 2. Most two important factor. So 2 is gone and 10 is gone. So 2 and 10. So first it will inhibit 2 and 10 followed by 9, 10 and 11. So all the factors are from either common or intrinsic pathway. So here we do monitoring by APTT. Here we do monitoring APDD. So this is the mechanism of action. Then here we can test it in vitro also, in vivo also, because it does not require liver activation. Here no need for liver activation. It inhibits that already synthesized factor. So factor number 2, 10, 9, 11, 12 2 and 10 are the earliest, and after that only 9, 11, 12. So it will show its action in vivo also, in vitro also. Here coagulation factor action is immediate, so it is given for initiation, not for maintenance. Maintenance we give warfarin. Take for monitoring. Monitoring we use APTT because these all factor are gone. So for monitoring we use APTT. APTT is first affected because common factor are also affected. Later on PT is affected, but first APTT is affected. Next, adverse effect bleeding, alophagia. Here also, then thermocytopenia, then osteoporosis. Something unique. We don't have any antidote. Contraindication except here pregnancy can given for this heparin can be given for pregnancy, but warfarin we never given for pregnancy. So this video discussed the anticoagulant drugs, mainly heparin and warfarin. These are the drugs list. Thanks for watching.